Hello, everybody. Good evening. We are very excited that we are going to be talking about how to prevent dementia. We will be talking about strategies for building cognitive resilience. And our work is based on Dr. Dale Bredesen's work. Dr. Bredesen is a neurologist, and he created this program called Recode back in 2014. The Recode 2.0 program to prevent and reverse cognitive decline. So we are just going to give it a couple minutes for people to join us, and then we will get started. In the meantime, what we suggest is if you know you have questions, go ahead and put them in the chat so that we can have a place to just collect them, and we will answer your questions at the end. Also, as we make our presentation, if you have questions that come up in your mind during the time that we are speaking, it's a good idea to put the question in the chat right away. Sometimes we tend to lose our questions if we wait until the end. So we recommend that you go ahead and put in your questions in chat as and when you have them. And then we will answer them at the end. Okay, we see people are joining, and we want to give it another couple of minutes. It's 6:02. Let's say we give it another minute and then we will get started. Thank you to all the participants for joining today. We are very excited to share our work with you and also to answer any questions specifically about this program or other questions that you might have about brain health, about dementia, and about Alzheimer's. So we are here. I have my colleagues with me. We are very excited to be talking to you soon. Dr. Rappaport and Michael, do you want to go ahead and say hello to people that have already joined us?
Welcome, everybody. We're very excited to share this presentation with you. And we hope that you learn a few new things tonight. And we're happy to answer any questions. I'm sure there will be a lot of questions at the end. There's a lot of information we'll be sharing with you.
Yeah, welcome everybody. Very excited to be here with you this evening for the learning opportunity. And I think, Manna, maybe we should launch into it. What do you think?
All right, let's do it. Okay, so once again, welcome everyone. We are going to talk about how to prevent dementia and strategies for building cognitive resilience. Again, our work is based on Dr. Dale Bredesen's groundbreaking work to prevent and reverse cognitive decline, the only program of its kind which has been shown to prevent and reverse cognitive decline. Dr. Bredesen himself told me not too long ago that for anyone that has participated in this program that did not yet have a diagnosis of dementia, nobody has yet gone on to develop this disease. That is a great statistic, and we want to keep it like that. So the three of us, Dr. Erela Rappaport, Michael Sanders, and myself, we came together short while ago to form the Center for Cognitive Resilience. And we did this because we saw how much need there is in our world to raise the awareness that dementia is preventable, and there is a lot that we can do. If you do a Google search on how to prevent dementia, you'll see you know how you're able to tell from doing a Google search of what people are searching for? People are not looking for how to prevent dementia. And that tells you that this is not part of the consciousness. People don't know that this is doable. So we are very passionate about raising awareness on this topic and also helping people prevent cognitive decline. So with that, I'm going to get started. Okay. So I am Manna Semby. I'm a naturopathic doctor. I am a Menopause Society certified practitioner. I am an Institute for Functional Medicine certified practitioner, and I am certified in the Recode 2.0 protocol. And I am passionate about midlife and brain health. So let's start by talking about, why does cognitive resilience matter? Why do we need to talk about it? We need to talk about it because it has become a really, really big problem. Worldwide, this is a $1 trillion problem. 45 million people, 45 million currently living Americans will develop Alzheimer's disease at some point in their lifetime. That is not a statistic we want to be a part of. So we want to figure out, what is it that we can do today? The other problem is, dementia is still considered untreatable. So people may think, if they have it in their family, if their mother had it, or grandmother, or father, grandfather, sometimes the belief is that, okay, it's just in the family, there's not a lot I can do. And we are here to change that notion. Other reasons why it's really important to take care of our cognitive health is, women are twice as likely as men to develop dementia. Women are twice as likely as men to develop dementia, and 60% of caregivers for dementia patients are adult daughters, right? So, especially adult women have a double whammy of risk for them, which makes it very important for us and all the adult women, especially of mothers and grandmothers with dementia. Super important to be cognizant of this fact and start taking action today. And finally, cognitive decline often begins 20 to 30 years before symptoms appear, right? So if somebody is getting diagnosed in their mid to late 60s or early 70s, imagine what was happening about 20 to 30 years before. The women were going through perimenopause and menopause. So, but that's not the only thing. Even for men, it's the same. So we need to look at many different factors that lead to a condition such as dementia. So, what needs to happen? What needs to happen in the world, in our consciousness? We need a shift in our consciousness. We need to go from nothing can be done to something can be done, and what can I do today? Right? We need to move from nothing can be done to something can be done, and what do I need to do today? So this book, The First Survivors of Alzheimer's, is a book that was published in 2021. Dr. Dale Bredesen wrote this book. And in this are stories of people that have been following the Recode protocol, and they are still thriving and doing really well. So I recommend to anybody that's interested to get this book, How Patients Recovered Life and Hope in Their Own Words, by following this protocol. So what we need to move from is reactive medicine, which means we want to wait until an MRI or a PET scan tells us that, okay, there is plaque in the brain and there is a diagnosis of dementia before we do something. By the time there is a diagnosis, even of mild cognitive impairment, we have let things go on too long. And we need to make sure we take action before that. So being passive about brain health is not an option. We need to take action today. Okay, so what stands in the way? This is Dr. Dale Bredesen himself. His company is called Apollo Health. And his perspective, which I agree with, is that what patients are doing so far is they do not seek medical care because they have been told there is nothing that can be done, and that there is a stigma of a diagnosis. We want to try and not think about it, not really investigate, because it's a difficult thing to think about. And also, if you get diagnosed, it's kind of like something that you don't want to talk about openly with others. And because of these two reasons, they often present very late in the process when they're just about to get a diagnosis. And often what happens is, the longer you let this go, the harder it becomes to reverse the changes that have occurred in the brain. So this is what stands in the way: the lack of information, the lack of awareness, and the lack of action. So what we are here today to talk about is, how do we educate ourselves so that we know what can be done and how it is to be done and when that needs to be started. So let's talk for a moment about the current healthcare situation, right? Memory care facilities cost anywhere between $9,000 to $12,000 per month. Memory care facilities cost $9,000 to $12,000 per month. And at many of these facilities, they will serve cake and all kinds of carbohydrates. And I have seen in some cases, they will serve alcohol too. And what they are not understanding is that eating like this is actually accelerating the end of life. And so we want to be very, very careful about figuring out where we stand in regards to our healthcare situation, our brain health situation today, and what do we want to do about it? How do we want to live 20 years from now, 30 years from now? What kind of brain health and facilities do we want to have available in us? Like we want to make sure we are fully capable and independent, and be able to take care of ourselves as long as we can. So this is the New York Times bestseller book by Dr. Dale Bredesen, The End of Alzheimer's, and this came out in 2014. This is the first program and the only clinically proven program to prevent and reverse cognitive decline in early stage Alzheimer's disease. Okay, and I would recommend for anybody that's interested to go ahead and note down this book as well, which will be very helpful for you to learn about the protocol and what all it entails, because this work is a pretty detailed, in-depth work. So it would be helpful for anybody interested to get this book and learn about it. In one sentence, what do we say? What is this program about? And we will go into it a little bit more detail, but the methodology basically is, by now, we know, and we are always updating this. Today, we know what are the known risk factors for Alzheimer's dementia. And as time goes by, we keep updating that list, right? But today we know what are all the known risk factors for Alzheimer's dementia. And the protocol is basically assess all of them, assess all the known risk factors, and then start addressing each one sequentially. We don't address all of them at the same time because that would be too much work for the body and for us to do. So we start with one thing at a time and we work on that for 2 to 3 months, and then we build on that for another 2 to 3 months, and we build on that. So we make sure we give you a strong foundation on which to rebuild your whole body and brain health. Okay, so known risks to brain health. So let's talk about this. Of course, genetics, we have to begin with genetics, because for the genetics of dementia, there are two pieces. One is the genes that are fixed, and the others are genes that are predisposing. So genes that are fixed and that we cannot do a whole lot about it, they are determinative. If you have that gene, then it becomes pretty difficult to avoid that condition. On the other hand, there are genes which predispose you to a higher risk of Alzheimer's dementia. We can do a lot in those instances. Okay, so the genes which are causative would be genes like PSEN1, PSEN2, APP genes, and the genes that are more predisposing are genes like ApoE. And you may have heard about ApoE a lot. If somebody is ApoE 3, 4, or 4, 4, your risk profile is a little bit on the riskier side. So it just simply means you need to be more proactive and start the work today, right? And in addition to genetics, what else is a risk factor? Heart disease is one. Because if you have heart disease, you have brain disease. It's the same blood vessels that are supplying the brain that come from the heart. And the blood vessels in the brain are much finer, so that if your arteries in the heart and around the heart have plaque in them, odds are the finer blood vessels in the brain also have plaque in them, and they can get blocked much more easily because the blood vessels are much smaller. Then let's move on to gut health, right? Gut health is a big one. If you have a leaky gut, odds are you have a leaky brain because the lining of the organs is the same throughout the body. And so if you have a leaky gut, that means things can go in and out of your abdominal system, your gastrointestinal system. Things can go in and out of your brain. Your blood-brain barrier can be breached. So it's really important to take care of your gut health. Then we come to infections. This is a big piece. Infections such as herpes or Lyme, even COVID, sometimes gentle infections like P. gingivalis that cause gingivitis, they can become a problem because they have a small distance to cover from the mouth to the sinuses to the brain. So super important to stay on top of that. Another big one in our world today is toxins. These can be mold toxins. These can be heavy metals. These can be chemicals. These can be glyphosate. So there are many kinds of, these can be plastics, forever chemicals that never biodegrade. So many kinds of toxins are in our environment today, and they make their way into our bodies all the time. Our body is set up to be a giant detox machine, but with the amount of environmental toxin load that we get these days, compounded by stress that is a part of our life today, our body can get to a position where it's no longer able to detox efficiently. So we need to figure out what toxic load you might be carrying and then figure out how to upregulate your ability to detox. Then we move into inflammation. This inflammation can be in different organs of the body. It can be overall in your cardiovascular system. It can be in your gut. It can be in your brain. It can be in different parts of the body. It can be in your joints. So depending on where the inflammation is, we need to find it out and we need to address that. Then another big piece is nutrition. The nutrition is not just the food you eat, but also um, your hormone level, your vitamin D status, your vitamin B12 status. So a whole lot of things go into nutrition. And then finally, the quality of your sleep, right? The sleep, during sleep is when the brain is clearing out toxins from the body. So if the quality or quantity of sleep is not enough, that's a risk factor. Chronic depression is a risk factor. Chronic stress is a risk factor. So we assess all of these. And let's go next into the assessment. Okay, and here we are. How we assess the risk factors. So again, genetics we do through blood or saliva testing. Heart disease we do through advanced cardiac and inflammation markers. Gut health we will do through breath and stool tests. Infections we will check for various antibodies to different bacterial and viral infections, and we will also check your oral health. Toxins, generally through urine testing, inflammation through blood and functional labs, nutrition through blood, urine, and hair sample testing, and sleep, depression, and chronic stress. We will go through sleep apnea screening and various other assessments, and Dr. Rappaport shortly will be talking about her work with sleep medicine. So I will leave that for her. So I've just very quickly gone over how we assess the risk factors. And now I want to move into how do we treat the various risk factors. The first thing to notice is this is not something that can be done very quickly. Doing this work takes time. In fact, doing all of these things and doing them right and addressing them properly takes about 1 year. So what we do is for genetics, let's say if you are ApoE34 or 44, we will work with you on what kind of foods you should or should not have. We will talk about what kind of specific protocols you might need to follow. For heart disease, depending on severity, we will work on reducing your blood pressure and cholesterol and may refer to a cardiologist if needed. For gut health, we will treat your bacterial overgrowth, your candida, parasites, and a whole lot of other things that lead to leaky gut. We will treat your infections by boosting your immune system and taking gentle herbal antivirals, and when needed, actual, prescription antivirals or antibacterials as needed. And of course, our dentist in our team for oral health. For toxins, we will use over-the-counter and prescription binders depending on what the need is. For inflammation, generally we'll do it through food, through supplementation, through stress reduction, through making sure that your sleep and exercise is dialed in. For nutrition, this is a big piece. We will make sure your omegas, your vitamin D, your estrogen, progesterone, all these levels are optimal. If they're not, we work with you to get them to a level where that would be optimized for you. And then finally, for sleep, for depression and chronic stress, we will work through various things like if there is sleep apnea, what do we need to do for that? Is there a need for cognitive behavioral therapy for that? Is there herbal and nutritional support needed? So we can do that. But remember, all of this takes time and it can take about a year because we start with one area. We start generally, unless there are other pressing concerns, we would generally end up starting with the gut and then we build on it with other things. So, but we do these assessments up front to kind of know what is the lay of the land, what is each person's specific risk profile, and how do we need to begin and proceed for each person. So our goal for you is long lives, sharp minds. We want you to be able to enjoy your life, enjoy your children, your grandchildren, enjoy your retirement. We want you to continue to lead your businesses, support your families without the fear of memory loss. Okay, now, how does Recode compare to the different drug therapies that are out there in the world today for dementia? There are three main drugs that are on the market. Actually, only two now, because aducanumab just got taken off the market earlier this month. And I'll tell you why. But basically, what this graph is showing us is this is a neutral line, this is the zero line. Anything that's below is where you're declining. Anything that's above is where you're improving. So if you do no treatment, you're declining the most. If you took aducanumab, you would still decline, but lesser by a certain amount. If you take the second drug that's currently on the market, lecanemab, you are still declining, but it's better, still better than doing nothing and better than aducanumab. And if you take the third drug, donanemab, which just got FDA approval in July, the expectation at this point is that you are still going to continue to decline, but the decline will be even slightly lesser than lecanemab as well. But they are all still on the negative side. And Recode is the only therapeutic approach that has been shown to improve brain health. Now, let's get into the drugs a little bit more. Aducanumab used to be called Aduhelm, and this was discontinued this month due to adverse effects. 41% of patients on this drug had brain swellings and microbleeds, and the drug came at a cost of $56,000 a year. Okay, lecanemab, Leqembi, fewer patients have adverse effects, but it's still 10% of patients that had brain swellings and microbleeds, and the price tag is about $26,500 per year. This is currently being used right now. And donanemab is the one that got approved in July 2024. It's called Kisunla. And we will be monitoring the patients for brain swellings and microbleeds. And it has a price tag of $32,000 per year. So the thing to keep in mind is that yes, the rate of decline that you see in the first year will be lesser than if you don't do anything, but in subsequent years, you are getting microbleeds and brain swelling, and that actually hastens the end of life. So it actually ends up being worse in beginning from second to third year. So unfortunately, the drugs have not been that successful. So we are back to Recode. Recode is a diet, lifestyle, healthy living, figuring out risk factors and reversing them approach, which we think is a much more holistic and wholesome way of addressing this problem. So does Recode work? How do we know? So there have been clinical trials that have been done, and 84% of patients on Recode have shown improvement in brain health, as opposed to 16% that declined and 4% that showed no change. 84% of patients have improved, and we continue to show that every day with the patients that we continue to work with. With that, I'm going to turn it over to Dr. Erela Rappaport to take us through sleep and dental health.
Thank you, Dr. Semby.
Mhm.
I will be speaking about the link between obstructive sleep apnea and oral health and cognitive decline. Next slide, please. So I'm Dr. Erela Rappaport. I'm a dentist. I have a strong commitment to promoting cognitive wellness through oral and sleep health. I'm a diplomat of the American Board of Dental Sleep Medicine, and I'm Recode 2.0 certified to help prevent and even reverse cognitive decline. So today I'm excited to share insights on how oral health plays its role in overall brain health, especially for those dealing with obstructive sleep apnea and its related challenges. Next slide, please. Thank you. So one of the most important parts of what I do is focusing on preventing the preventative measures that can make a big difference in both oral health and overall health. So the first place that I start is with a comprehensive dental exam. It's a thorough assessment where I look closely at your teeth, your gums, your jaws, your TMJ, as well as conduct an oral cancer screening. This exam helps me catch any potential issues early on. The next part is a periodontal health evaluation. This is an examination of your gum health, looking for any signs of periodontal disease, which is very important because we know that periodontal disease has been linked to cognitive decline and obstructive sleep apnea. So we want to identify and address it so it can have its far-reaching benefits. Finally, I incorporate an obstructive sleep apnea screening. So during a dental exam, I can see some of the physical indicators of sleep apnea, like a narrow airway or enlarged tonsils. So if these indicators are present, it might suggest further testing. And we want to be proactive in all these areas because with this information, we can create a personalized plan to help support your health both now and in the future. Next slide. So let's talk a little bit about obstructive sleep apnea. In a healthy sleep cycle, breathing is smooth and uninterrupted. Air flows freely through our airways, allowing us to breathe without effort. But with obstructive sleep apnea, as the muscles of the throat relax during sleep, the tongue either completely or partially closes the airway, blocking the flow of air and oxygen and disrupting sleep. These constant interruptions prevent deep, restful sleep, and poor sleep quality and quantity, including frequent wakings and not achieving deep restorative sleep, impairs the consolidation of our short-term memories into long-term memories, and also the cleansing of the brain of beta amyloid plaque, which is the hallmark of dementia. Next slide. So we can see that obstructive sleep apnea has a wide spread effect on various parts of the body and the mind, both in the short term and in the long term. We know that it causes daytime fatigue, it fragments sleep. We get excessive daytime sleepiness, reduced alertness and concentration issues, memory problems, difficulty focusing and slower reaction times, and of course, increasing the risk of dementia. It puts a lot of pressure on our cardiovascular system. It can cause high blood pressure, heart disease, irregular heart rhythms, heart attacks, strokes, even sudden death. When breathing stops repeatedly during the night, it puts a tremendous stress on the heart and the entire cardiovascular system. It will affect our metabolic system and can increase the risk of type 2 diabetes and can worsen insulin resistance even in people who are not diabetic. It impairs our immune response, making it harder for the body to fight off infections. People with sleep apnea have symptoms similar to major depressive disorder like anxiety, depression, irritability, and weight gain. Snoring, which is one of the most common signs of sleep apnea, can disrupt not only your sleep, but your bed partner's sleep. And that could affect relationships. You might have heard of the sleep divorce, where the two partners are actually sleeping in separate bedrooms. Sleep apnea significantly increases the risk of car accidents and workplace incidents. Excessive daytime sleepiness and poor concentration can cause people to fall asleep at the wheel or during tasks, resulting in serious, even fatal accidents. There are more car accidents that are related to daytime sleepiness than even from drunk driving. One of the most serious consequences of untreated sleep apnea is an increase in sudden death, particularly from heart-related causes. During sleep, this sleep apnea can trigger severe drops in the oxygen levels, which can cause fatal cardiac arrhythmias or strokes, especially with people with pre-existing heart conditions. And next slide, please. So let's now talk about what a customized sleep apnea treatment would look like. If we identify symptoms of sleep apnea, the next step is to gather more data to confirm and understand the severity of the issue. This often includes a sleep test, which most of the time can be done at home in your own bed. Sometimes it would need to be done in a sleep lab. Once we have this information, we can create a personalized treatment plan. The goal is to help you fall asleep and stay asleep throughout the night, allowing your brain and body the time it needs to properly recover and heal. To make this treatment as effective as possible, we may use advanced tools like a cone beam CT scan, which gives us a detailed view of your airway and any structural factors that could be contributing to sleep apnea. Combined with the results from a sleep test, we get a comprehensive picture of your condition, and that allows us to design the most effective individualized approach to improve your quality of sleep and overall health. And next slide, please. So how is sleep apnea treated, and how can you start getting some good quality sleep? Well, there are some things that you can do on your own with some lifestyle changes like losing weight, avoiding alcohol, avoiding sedatives, stopping smoking. But if you are diagnosed with severe sleep apnea, you will be given a CPAP machine. This is a machine that's connected to a mask, and it delivers a continuous stream of air, keeping the airway open. That's a picture on the lower left. If you were diagnosed with mild or moderate sleep apnea, then a oral device can be used instead of a CPAP, and that's the picture of the device above the CPAP. It is something that resembles a night guard that you would wear during your sleep. They work by gently repositioning the lower jaw forward, and when the lower jaw comes forward, the tongue comes forward with it, and that keeps the airway open. There is something called Inspire that you might have seen on commercials. It's a device that gets implanted similar to a pacemaker, and it stimulates the tongue for the tongue to move forward and to one side, opening up the airway. Sometimes surgery is recommended, especially if there are very large tonsils that are blocking the airway. Sometimes we use a combination of these therapies. There's other things that we could add if needed, such as myofunctional therapy, which helps retrain the tongue, or cognitive behavioral therapy for insomnia. Next slide. Next slide, please. Okay. So let's change gears for a minute and talk about oral health. So research has shown us that individuals with poor oral hygiene practices are 1.5 times more likely to develop dementia than those people with good oral care habits. One of the key bacteria responsible for gum disease is P. gingivalis, and it's been shown, it's been discovered in the brains of individuals with dementia. Along with the bacteria, we also find inflammatory markers that are associated with gum disease have also been found in the brain, suggesting that oral health can contribute to the inflammation of the brain. And so we can see that gum disease could play a very big role in the development and progression of cognitive decline and dementia. Gingivitis is the earliest stage of gum disease, and it's characterized by inflammation, redness, puffiness, and bleeding of the gums. If it's left untreated, it can progress into a more serious form of gum disease called periodontitis or periodontal disease. And that's the more advanced stage of gum disease, which leads to loss of the supporting bone. If we take a look at the next slide, I can show you the difference between what a healthy tooth looks like and a tooth that has periodontal disease. You'll notice that the tooth with periodontal disease has plaque on it. Plaque is a combination of bacteria and food particles. When the plaque gets mixed with saliva, it will become a harder material called calculus or tartar. And that tartar will start to grow above the gums, but even worse, under the gums. That tartar is hard, it adheres to your teeth. You can't get it off by simply brushing and flossing. That's where your dental hygienist comes in, and she can clean off that calculus and remove the plaque. But as that calculus and plaque is staying in your mouth, it will cause the inflammation of the gum tissue. Again, becomes red, puffy, bleeding. And then eventually it will affect the underlying bone, which will start moving away from the tooth, and ultimately the teeth become loose and will get lost. Plus we have that bacteria and the inflammatory factors, which are getting into the bloodstream, going to your heart, going to your brain, causing dementia, heart disease, even diabetes. Next slide, please. So how do we treat periodontal disease? Well, the very first part is to have that comprehensive evaluation. We need to take a close look at the gums, see exactly where the periodontal disease is and how extensive it is. The next step would be a cleaning. Sometimes we need to do a deep cleaning with scaling and root planing. We sometimes add laser therapy, which helps eliminate the damaged gum tissue. Sometimes we'll add a product called PerioProtect, which is a customized tray system that helps deliver a gel that can kill the bad bacteria that hides under the gum line. Sometimes we need to bring in a specialist, a periodontist, to help treat those areas that are not responding to regular treatment, and they need to do some kind of surgery to remove the diseased tissue and to make the areas more cleansable, so that you not only treat the gum disease, but you don't allow it to come back. So I'd like to leave you with this important takeaway. The health of our mouth, our sleep, and our brain are all deeply connected. Good oral health is more than just maintaining a bright smile. It's also essential for preventing systemic inflammation and supporting cognitive health. Proper sleep, especially for those with sleep apnea, isn't just about feeling rested. It's crucial for allowing the brain to repair itself, to organize memories, and to clear out toxins that could otherwise contribute to cognitive decline. And now I'd like to turn over the program to Michael Sanders.
Thank you, Dr. Rappaport. I'd like you all to just take a moment to imagine this scene. A mother and her daughter are sitting across from one another. They've been part of each other's lives for many years. The mother looks at her daughter, confused, and asks, "Who are you again?" That sinking feeling, that moment of realization that something is deeply wrong. It hits her hard as she thinks, what can I do about my mom? Some of us may have experienced this. It's a reality we dread, yet one we've come to expect. But what if I told you this doesn't have to be your future? Next slide, please. My name is Michael Sanders, and I'm the health coach on the team. And today we've been sharing with you the most recent science in brain health. And unfortunately, most people still don't know that we have the capacity to prevent cognitive decline and even reverse early stage Alzheimer's. Next slide, please. Did you know that lifestyle choices account for roughly 55% of your brain health? That's right, more than half of your cognitive health is determined by your daily actions, from the food you eat, the exercise you do, the quantity and quality of your sleep, how you manage stress, and on and on and on it goes. Everything we do impacts our health and vitality. This is why it's critical to be mindful, intentional, and purposeful of the things that we choose to do and not do, day to day, moment to moment. Next slide, please. We strategically utilize these 7 lifestyle areas in our program: nutrition, exercise, sleep, stress reduction, brain stimulation, detoxification, and supplementation, in order to help our patients prevent cognitive decline and to build resiliency and support neuroplasticity. Neuroplasticity, it's the ability of our brain to heal, to grow new neurons, to build new synaptic connections, creating new pathways for memory and learning. The Bredesen 7 are built on a foundation of mindfulness. And as we know, mindfulness can refer to practices like meditation, but it goes beyond that to include being discerning, intentional, and purposeful in our choices, the choices that we make and the actions that we take. And especially when it comes to building new behaviors and habits in these 7 lifestyle areas. Next slide, please. But here's the challenge. Knowing what to do is one thing, and actually doing it is another. That's where I come in. As a health coach, my job is to make sure that my clients succeed, period, exclamation point. Now, I usually won't show up to coaching calls in my hiking gear, but I have gone on hikes with clients before. And if you want to meet me on the trails, I'm totally up for that. So what does working together entail? After reviewing a patient's cognitive assessments, lab results, health history, Recode report, and Dr. Semby's treatment plan, the client and I strategize a plan to incorporate the lifestyle habits and routines into their life in a sustainable and an achievable way. And keep in mind, this is a 12-month program and it's not a cakewalk. Anybody who embarks on this journey is expecting to get to a different destination than the one that they're currently heading towards. They want to produce different results with new possibilities. And while our patients clearly expect different results, they don't get there if they're not willing to make changes to their current habits and behaviors. So as to not overwhelm our patients, we focus on 1 or 2 areas at a time, making small changes that are sustainable. 12 months down the road, we can look back at where we were and see that we made progress toward our intended results. One person came to me feeling completely overwhelmed. He knew what he should be doing, but the changes he was trying to make on his own were not sticking. His challenge was carbohydrates. Can anyone relate to that? Growing up in South America, carbs were a huge part of his upbringing. He loved the rice and beans, the delicious pastries, even the sugar-laden passion fruit juices. But he knew how important it was for him to make these changes because his mom, who had Alzheimer's, was getting worse and worse, and now he was in his late 50s. By working together, we broke it down into manageable steps, one small win at a time. Over the course of months, those small wins turned into life-changing results. His memory improved, his energy returned. He felt better than he'd felt in years. Next slide, please. While I focus on all 7 lifestyle areas with my clients, the one that we focus on first is the area of nutrition. Typically, this is the most complex one to implement. Let's take a deeper dive into why this is and how we utilize nutrition strategically in our program. For anyone who wants to prevent cognitive decline, nutrition can be the linchpin between preventing decline or not to mention many other chronic diseases that we want to avoid. First, let's look at the easy side of the nutrition equation. This is what I call bad for you food. Unfortunately, many people are taking this path. Not only is it easy, it's also cheap and convenient to go to McDonald's for a Big Mac, fries, and a Coke. It's even easy to say, try it with me. I'll have a Big Mac, fries, and a Coke, please. See what I mean? Or just go to Burger King and have it your way. This is where mindfulness and intentionality come in. McDonald's and Burger King, they don't have our best interests at heart. We know better, don't we? Next slide, please. Now let's look at the other side of the nutrition equation. I call this the good for you food. Why? Because it can help you lose fat, reduce inflammation, and get you into ketosis. Ketosis is a natural process by which your body uses dietary fat and breaks down stored body fat to use as fuel. Now, who wouldn't want to use your stored body fat for fuel? Well, good for you food sounds good. Keep in mind that it requires mindfulness, more effort, greater expense, and it's not convenient. But if we're committed to our health, we go to the grocery store, we buy our wild salmon, an avocado, broccoli, mushrooms, zucchini, and maybe some cultured vegetables. Then we go home, we prep it, we cook it, and finally we get to eat it. And hopefully, and eating it should be the best part, right? Then we clean up the mess, pots, pans, and dishes. And, the bottom line is that's why eating delicious, good for you food is somewhat complex. But let's not make perfection the enemy of good enough for now. It may take you several months to get there, but don't worry. As long as you're making progress, that's what's most important. And you don't have to only eat wild salmon. There are many, many other healthy protein choices, including vegetarian options like tempeh and tofu. Yes, you can do this even as a vegetarian, and you don't even have to cook every single meal. I explore as many options as possible with my clients to help them take the complexity out of eating good for you food. Here are a few ideas. There are services that send you the ingredients for a certain number of meals each week. You can go to restaurants, and you may even find some healthy Uber Eats options. Next slide, please. This is the KetoFlex 12-3 food pyramid. And when practiced correctly, this diet becomes a lifestyle that contributes greatly to preventing and reversing cognitive decline. It's a heavily plant-based, nutrient-dense, whole foods diet. It emphasizes local, organic, and seasonal, non-starchy vegetables, and it includes an adequate amount of protein and a generous amount of healthy fats. In addition, we recommend a 12-hour overnight fast, including 3 hours prior to going to bed. Except for patients who have an ApoE4 gene, then their fasting window is slightly longer to about 16 hours a day. So this can look like finishing dinner by 7 p.m. No more food before you go to sleep at 10 p.m. And then the next meal would be any time in the morning after 7 a.m. That's a 12-hour fasting window. Now I'm going to turn it back to Dr. Semby to share details about our program, and then we'll take your questions. Dr. Semby?
Yes, thank you.
You're welcome.
Okay, so let's talk about what is our approach. So the first thing to notice is we have a team care approach. All 3 of us are trained in the same protocol, and we are all keeping our eye on the ball. Our plan is to see what your risk assessment shows us, both with the blood and functional labs with me, and also what the oral and screenings have shown with Dr. Rappaport, and then putting that whole plan into practice with Michael's help. So through the 1-year program that we work on your heart health, on your gut health, on immune health, hormone health, reducing inflammation and toxin, optimizing your nutrition, and of course, oral and sleep health. So, what does it entail? It entails 10 visits with me, your functional medicine doctor. It entails 10 visits with Michael, our health coach. It includes oral and sleep apnea screening with Dr. Rappaport, and that generally includes a cone beam CT scan and most likely an at-home sleep study if it looks like you're a candidate for it. And so that is what we include in the program of working with us for the whole year. Now, remember that labs and supplements are not included in our plan that we work with you, but we can give you an idea of what that would be like. How we begin this program, or how we like to recommend people begin this, is with something called a cognoscopy. You've probably heard of a colonoscopy, which is now recommended in your 40s once a year. And if you do this with a certain frequency, if there are beginning signs of colon cancer, you can catch it early, you can treat it. And as a result, the fatality from colon cancer has gone down significantly. In the same way, Dr. Bredesen recommends that in your 40s, everybody should have what is called a cognoscopy. And what that entails is things like the brain scan. This is a new kind of blood test that can detect plaque in the brain way before an MRI and a PET scan can. This is a simple blood test, and the blood tests are just now that much more sensitive and specific. They can talk about non-specific brain inflammation, and it can also show us Alzheimer's dementia specific pathology just in a blood test. So that's number one, and that's new this year. So that's why we are always on top of what is the latest that's coming out in brain health. Then we do assessments like the MOCA. This is a cognitive assessment which has been validated for decades and is a very objective and useful way to figure out what's the status of your cognition based on a test, a simple test that can be done in person or online. And then finally, there are things like neurological assessments that generally you'd end up taking on a computer with a keyboard, and you're looking at patterns and you're answering questions as instructed by the test. So the combination of these three things tells us your different parts of your brain health, and we can form a composite of what it looks like, and that helps us direct our direction, the course of our direction, as we begin to create a plan for you. So how at CC, at the Center for Cognitive Resilience, how we work with you is we have three things, and these are three interlocking phases. So the first thing is a team care approach, right? So there is myself, my functional medicine doctor. There is Dr. Rappaport, who is sleep and oral health doctor, and then there's Michael. So it's a team care approach. We all work with you and we make sure that we are addressing your health from a global perspective. Then there is a commitment. We commit to your care for the year, and you have to commit to the program and your own improvement. If any of those components are missing, we will not get success. So it's really important to be on the same page on what needs to be done, what is the expectation, what needs to be done first, then what needs to be done, and then finally what needs to be done. This way, we can make sure you have the best chance of success and the most enduring success possible. And finally, we recommend that patients have an active Recode account. What this means is Recode is a protocol we are all certified in. This is a program devised and owned by Dr. Bredesen. And on his website, the Apollo Health Co website, there are a lot of resources that you can have access to. There are monthly assessments and screenings, support groups, and a lot of forums that can be really helpful for you and your loved ones and your caregivers as you go into this program. There are three phases in our work with you. The first is a meet and assess. That is what we call the embark phase. As part of this, we do a cognitive assessment and we kind of figure out, are we a good fit for working together? The second is the engagement phase, where we decide what program is right for you. Is the Recode right or the Precode right? That includes talking about Apollo Health. That includes talking about the baseline labs, health coaching, and team-based care. And finally, number three, which we say here is number three, but something that's really going on right from step one, which is evaluation. So we are constantly evaluating the work we are doing and the progress you're showing and the work that you're able to do and any changes that we need to make through the whole program. So stages 1, 2 happen sequentially, and 3 happens right along with stage 1, and it continues on. So with that, we are at the end of our presentation, and we would love to open it up for questions. And please go ahead. And if you have any questions, just let us know. Or you can type it in the chat. I don't see a Q. There is a Q&A. Let me see. Is there a Q&A here?
Yes, and there is
Okay.
one question in the Q&A right now.
Okay, let me see if I can get to it. Let me see.
If you can't, I can read it.
Yes, can you read it? I can't see the question.
Yeah, this person says, when I have difficulty sleeping or when I want to have a long, deep sleep, I take half of a tiny tablet sleeping aid that is available at Costco. That gives me a good night's sleep. It says on the bottle that it does not have that it is not addictive. Will that help me? Secondly, is your plan covered by, say, Anthem Blue Cross?
Okay, great questions. I would like to know what is the name of this supplement. Is it melatonin? Is it a mix of melatonin with some herbs, let's say like valerian or some of the other magnesium perhaps? So I would like to know what's the name of that supplement from Costco. If it is melatonin, I have no problem with it. Occasional or even more than occasional use of melatonin is okay. It is an antioxidant. We just don't want to overdo it, like we taking 5, 10, 15 milligrams of melatonin unless it's needed. Higher doses of melatonin are reserved for other things. So as long as it's melatonin, or I would think from Costco, I don't really have a problem with it, especially if it gives you the restful sleep and you wake up rested next morning. That's great. And then your second question is this covered by Anthem or any other insurance? The short answer is it's not. It's not, because this is the kind of care that takes time. It takes a lot of time, 10 hours with me over a period of a year and 10 hours with Michael over a period of a year. This is a lot of time, effort, energy, and action. And unfortunately, because our insurance is set up to be not a healthcare model. It's really like taking care of something once you already have a diagnosis, then it might pay for your visits and it might pay for medications, but it's not set up to do proactive care. So we do not take insurance for our program. And as far as insurance is concerned, for Dr. Rappaport's work when it comes to dental and sleep, Dr. Rappaport, would you like to address that?
Sure. Depending on the type of dental or medical insurance, if we're dealing with sleep, it really will depend on the plan that you have personally. And we work with many, many plans, and we could make this work for you, no matter what kind of dental plan or medical plan that you have.
Yes, so possibly for your sleep and oral health, there may be insurance coverage, but for the rest of overall work, I would say we are not able to accept insurance. And it would be great if, as a country, as a system, we could get to that place where we could deliver this kind of care using insurance. That would be really wonderful. Michael, is there another question?
Yes, the person did indicate that it was not anything like melatonin.
Interesting.
Another question, can this program be shared with someone not living here in San Diego?
Yes, of course. it would depend on where they live. Certainly, if they are anywhere in California, it's of course possible. Anywhere in the US, yes, it's possible. We do have people travel from other states to us to see us once a year, because that way Dr. Rappaport can do the oral and sleep screenings, and I can do an in-person assessment of their status once a year, and then we can continue over Zoom or over the phone, depending on what the need is. So yes, it is possible.
Yeah.
Okay, next.
Okay, next question. Let's see, that person talking about the sleep medication said the main ingredient is doxylamine succinate.
Yeah, I can answer that question.
Right.
That is an antihistamine that is okay, that will help you fall asleep and stay asleep. And it's okay for occasional use, but it's not something that you want to use regularly, because use of that medication actually increases the risk of dementia and Alzheimer's if it's taken for the long term. So you want to be careful with that sleep aid.
Also, I would say that if you are needing to take an antihistamine to sleep, like I do know some people, things like Benadryl can have that drowsy effect. And sometimes it can be helpful if nothing else is working. But what we have to see is, why is it that the antihistamine is the thing that works for you? Perhaps you have tried other things. Or not tried other things. If you've not tried other things, that it's worth trying some of these other things. And then if this is the only thing that works, then it's really worth getting into why is it that this thing works and what's happening inside your body that it needs. The immune system is asking for an antihistamine. That means, are you producing too much histamine, and do you have allergies and other sensitivities in the body? And so that is definitely something that we would address as part of your risk profile.
Great. We only have one other comment here, who's saying she would like, or he would like, the reading material only if you can listen audibly. And yes, everything that we've mentioned here should be audible.
Yeah.
With that, I think we're at time.
Okay, great. Well, we are very thankful to all of you for coming to attend today. We have the QR code right here on the screen. If you would like to book a discovery call and ask your specific questions and share your specific health history and concerns, you are welcome to do that. We welcome you to book the discovery call. This is time that we allow for you to get your questions answered. Often what happens is, as Michael said, we know what we need to do, but sometimes we are kind of a little bit hesitant, a little bit delinquent. And sometimes the hardest part of prioritizing your health is just deciding to start, right? So I'm inviting you today to just do it. Take that step for yourself today. And you don't have to have it all figured out. You just need to be willing to explore what's possible, what support could look like for you. And by taking this step, you choose clarity and resilience and a bright brain for a long, long time to come. Thank you so much. Okay.
All right. Thanks, everybody.
Thank
Take care.
you.
Bye-bye.
Bye.